Welcome to Week 2 Legal and Ethical Responsibility in the DPS NCLEX Success Track. In this session, we'll focus on the ethical and legal foundations of nursing practice, understanding how to protect patients, uphold their rights, and maintain professional accountability. Legal and ethical awareness ensures that nurses provide care that is safe, compassionate, and just. By the end of this module, you will be able to define ethical and legal responsibilities in nursing, distinguish ethical principles from legal obligations, apply informed consent, confidentiality, and documentation standards, safely use delegation and scope of practice, prepare for NCLEX-style legal and ethical questions. Let's explore how these concepts apply to everyday nursing practice. Ethics are the foundation of nursing professionalism. Let's review 6 core ethical principles. Autonomy: respect the patient's right to make their own informed choices. Beneficence: always act in the patient's best interest. Non-maleficence: do no harm, balance risk and benefit in every action. Justice: provide fair and equal care to all patients. Fidelity: keep promises, maintain accountability, and advocate for patients. Veracity: tell the truth and communicate honestly. Together, these principles guide safe, ethical decision-making. Informed consent is essential to patient autonomy. The provider explains the diagnosis, risks, benefits, and alternatives. The nurse verifies that the patient understands, witnesses the signature, and ensures voluntariness. The patient must have the capacity to decide and can withdraw consent at any time. Always use a certified medical interpreter for non-English speakers. Never rely on family members for interpretation. Decision-making capacity means the patient can understand information, reason about choices, and communicate a decision. Minors or cognitively impaired adults may require a legal guardian or surrogate decision-maker. In emergencies, when a delay could threaten life or limb, consent is implied. Nurses must recognize when patients can and cannot make independent decisions. Confidentiality is both an ethical and legal responsibility. Only share patient information when it's necessary for care or required by law. Avoid discussing patient details in hallways, elevators, or online. Always safeguard patient data and follow HIPAA guidelines. Remember, you may be required to report suspected abuse, certain infections, or threats to safety. Documentation is your legal record of nursing care. Chart objectively, accurately, and on time. Include date, time, signature, and all relevant observations, actions, and patient responses. Never chart for another nurse or coworker. If it's not documented, it's considered not done. Good documentation protects both the patient and the nurse. Document facts only, no blame. Do not mention the report in the medical record. Delegation ensures safe and efficient teamwork. Each role has a defined scope of practice. RN performs assessments, develops care plans, teaches, and gives IV pushes. LPN/LVN cares for stable patients, reinforces teaching, and administers routine medications. UAP provides basic care, hygiene, intake and output, and vital signs. Follow the 5 rights of delegation: right task, right circumstance, right person, right direction, and right supervision. Restraints are used only as a last resort. Always attempt non-restrictive alternatives first, such as a sitter or calm environment. A provider order is required and must be time-limited. Monitor skin integrity, circulation, and behavior frequently. Document everything and remove restraints as soon as possible. Remember, 4 side rails up equals a restraint unless protocol allows it. Patients have the right to refuse treatment, even if the nurse disagrees. Assess the patient's decision-making capacity, explain risks and alternatives, and document understanding. Notify the provider and offer follow-up instructions or return precautions. Respecting autonomy means supporting the patient's informed choices. A do not resuscitate DNR or advance directive expresses the patient's wishes about life-sustaining treatment. Verify these documents upon admission and at each care transition. Honor the patient's stated level of intervention: full, partial, or comfort-focused. If disagreements occur between family and patient wishes, seek an ethics consultation. A competent patient's choice always takes priority. End-of-life care centers on comfort, dignity, and respect. According to the principle of double effect, Providing medication to relieve suffering is ethical even if it unintentionally shortens life, as long as the intent is comfort, not death. Cultural and spiritual beliefs may strongly influence end-of-life decisions. Always provide compassionate, patient-centered care. Cultural sensitivity enhances trust and safety. Assess each patient's beliefs, values, and preferences. Respect rituals, dietary needs, and healthcare choices, including refusals. Provide professional interpreters and inclusive care to every patient, regardless of language or background. Avoid actions that could create legal problems. Copy-pasting or altering documentation. Late entries without labeling them. Delegating outside your legal scope. Sharing patient information on social media. Ignoring the chain of command when a safety issue arises. These are preventable errors that can have serious professional consequences. Expect NCLEX questions on ethical and legal scenarios. Use frameworks like ABCs for prioritization, Maslow's hierarchy of needs, safety and risk reduction, least restrictive, least invasive. Remember the role boundaries. RN initial assessment, teaching, and evaluation. LPN stable patient care and reinforcement. UAP routine care and observations. Before you finish, reflect on these questions. Which nursing actions best respect a patient's autonomy? How should tasks be distributed among RNs, LPNs, and UAPs? Why shouldn't incident reports be documented in the patient's chart? Which ethical dilemma requires the earliest ethics consultation? These help reinforce clinical judgment and prepare you for NGN-style items. Legal and ethical nursing practice protects patients, ensures trust, and defines professional integrity. When you apply these principles, autonomy, beneficence, and justice, you uphold the heart of nursing: safe, compassionate, and ethical care for every patient.